Yes.
I just have a very few questions for you, Professor. Is there a greater chance of getting leukemia or other cancers if a patient is suffering from HIV or hepatitis C?
There is statistically a greater likelihood, but not great numerically, with both those viruses of cancers with HIV, which might include something called Kaposi's sarcoma, and cancers with hepatitis C, which often relate to the liver, but they are infrequent. In terms of leukemia, I do not know of an association offhand with hepatitis C, and I think there are some rare leukemias which may be slightly more common in HIV patients, but not very significantly.
And is the same question, but in relation to somebody that's had treatment for either HIV or hepatitis C. So is there a greater chance of getting leukemia or blood cancers or other cancers in a patient who has had treatment for those viral infections?
I hesitate because it's difficult to know precisely, but I think the treated patient in both categories who's subsequently in remission, I would suggest has a lower chance of developing another cancer, but that it is the slight increase is not completely eliminated.
Are there any specific complications in patients who have a blood cancer and have a bleeding disorder as compared to a patient with a blood cancer without a bleeding disorder?
Obviously, it's a terribly unfortunate coincidence that if you have a congenital bleeding disorder and then you develop a blood cancer, that goes without saying. As far as I know, there are, in most circumstances, not an intrinsically worse outcome with treatment, but one can imagine that the treatment of leukemia in the way I've just described, which necessitates almost deliberately lowering components to clear the bone marrow, would be practically more difficult in someone who has a bleeding disorder as well. So I think it makes the treatment more difficult, but does not have an intrinsically worse prognosis, if that makes sense.
And then lastly, if a patient with a blood cancer also has hepatitis C or indeed HIV, is treatment for that cancer still indicated?
Well, it depends very much on the individual case and the stage of it, but I would say certainly yes, in very many cases with the modern treatment of both. There is no reason why you cannot also, if those conditions are under control with modern treatment, give absolutely effective cancer therapy. So it's difficult without seeing the individual case, but there's plenty of opportunity in many cases for a successful outcome to the cancer if the underlying viral infection is under control.
So you would expect there to have been treatment for the underlying viral infection and then treatment for the cancer?
Yes, if as the treating physician you would hope to get the patient at the point where the viral infection had been addressed. If they both present de novo at the same time in 2022, treatment of the cancer and the virus can be addressed at the same time, but it would make both the pathway more difficult and the outcome less certain. But certainly I wouldn't say just across the board that there isn't treatment, because there is in some circumstances.
So those were all the questions that I had from core participants to ask Professor Goldstone. May I just turn behind me? No questions from his legal representative.
Well, I have no questions either.
So I think then it's for me to ask Professor Goldstone whether there's anything you would like to add to your evidence.
The only thing I would like to say, as perhaps I should have said at the very beginning, is I want the patients and their families affected by this terrible tragedy to know that the haematology community looks at itself every minute of the working day and beyond to see what it could have done better and how it might do better in the future. We have taken this enormously seriously, and I hope that succour and support by whatever measure comes from this inquiry to those who are affected.
Well, thank you. It's been a delight to listen to someone who is obviously so enthusiastic about the work that they have done, especially your I think 35 years as a consultant at University College. So thank you very much for coming and sharing that and your thoughts and experiences with us.
Thank you, sir.
So 2 o'clock then, is it?
2 o'clock for Dr. Thomas.
Thank you very much.